This is Jeffrey Strickland again from MOT 136, and I'm doing procedure 30-5, setting up a sterile field with instruments. I'm going to use the instruments that I have prepared and have, by simulation, autoclaved. They haven't actually been in the autoclave. We'll pretend that they have. So they'll still be in the sterile package. And I don't have, per se, a sterile drape, so I'm using a sterile disposable maternity blanket. So it's a little bigger than a drape would be, but I'll just have it folded over once. So the first thing you do here is you wash your hands, put on non-sterile gloves and any other appropriate PPE. And then you grab, for example, your Mayo instrument tray. I don't have that. I'm using my desktop, and right now the desktop is above my waist level. We're going to consider anything that goes below the table level or down to where my waist level is not sanitized or sterile. Now we take our pre-selected disposable sterile field drape and place the drape package on a clean surface. We open the package and expose the fan folded surgical drape, and then using only the thumb and the forefinger of one hand, we carefully grasp the corner without touching the rest of the drape. Then we pick it up high enough that it doesn't touch anything unsterile, including the Mayo tray. We also want to keep it above waist level and away from the body to ensure that it remains sterile. And then we reach over the Mayo tray with the drape, but we don't allow the drape to drag across or otherwise touch the tray itself. Then we gently pull the drape toward us as we lay it on the tray. And if we need to make any adjustments, we do so. And it's important to remember that the outside 1 inch is considered non-sterile. So it's okay if you touch that as you pull this tight on this flat surface or this simulated Mayo tray. And you want to make sure that's nice and flat. And now, again, the only thing sterilized in the area is just this sterilized field. So for my autoclave, I've removed the instruments that I had packed before. They haven't been steamed, but we'll pretend they have. And the outside of this package is not sterile. Only part is sterile is the inside of the package. So we want to be careful not to touch the surface of the sterilized field with the packet itself. So once again, these pre-sealed or self-sealed bags have a place where you open them at the top, and then we can just pour the instruments out onto the field. Careful not to touch the field itself. We had on non-sterile gloves when we laid this down, careful not to touch the sterile surface. So now we want to do the procedure for putting on sterilized gloves again, which was procedure 30-1. So I'm simulating that since I've already done it, and I'm assuming that the gloves I have on now are sterile. And then with our sterile gloves on, we can arrange the instruments as the provider might want them arranged. Now we're going to also assume that we're going to use this immediately. We have a patient waiting to have minor surgery. We're in that room with this tray. And one thing that we can't do at this point is leave the room. If we leave the room, then we cannot guarantee that the surface is still sterilized. So that's a no-no. The other thing, and I mentioned this before, is if you have an instrument, and let's say you were taking these out of the bag by hand, and you were holding this below the table level, then that instrument cannot be assumed to be sterilized. So you have to make sure that you stay above waistline or above the top of the tray as you put instruments on the tray or remove them from either their packaging or their self-sealed package from the autoclave.